Thank you very much, Dr. Zhao. Our next speaker is Dr. Alton Romig, Jr., the Executive Officer of the National Academy of Engineering, a partner in this workshop activity. Prior to joining the NAE, Dr. Romig served as Vice President and General Manager of Advanced Development Programs, better known as the Skunk Works, at Lockheed Martin Aeronautics Company. Dr. Romig.
Thank you, Jim. Let me start, of course, by, on behalf of the National Academy of Engineering and our President, Dan Moat, offer our welcome, not only to those of you who are sitting here in the audience, but also to the 100 or more that are online with us through the web. I'd also like to thank the Pan American Health Organizations for hosting the event here. This is really quite a facility, and now that I know that it's only a block away from our building, I suspect we'll be back again. It's a very, very nice facility. And I would also echo Dr. Zhao's comments that in terms of congratulating the planning committee that were led by Lonnie King and staff team led by Guru Madhavan in producing a truly multidisciplinary and cross-academies workshop. And I'm glad to see that the technology sector, in addition to the medical sciences sector, is well represented in this important dialogue and conversation. You know, it's interesting when I think about this from a technological viewpoint. It made me reminisce back to my days prior to being at the Skunk Works. I had been at Sandia National Laboratories, which Lockheed actually has a contract to run. And at one point, actually back during the days just after 9/11, I owned all the Homeland Security programs that included detection, mitigation of biowarfare hazards, a bioattack in the U.S. We had a lot of expertise in place in terms of building sensors to try to detect pathogens and so forth. And people had these ideas about, let's go put a detector in every parking meter, because we knew the parking meters were going to go wireless, as we all see today. In fact, they are. You go up there with your credit card or your smartphone, and you pay the bill. And we're going to get all this data. Isn't that going to be wonderful? But then the thought crossed our mind is, oops, what are we going to do with all this data, right? And we felt we were in a situation of drowning in data, but being starved for knowledge. And so in addition to investing in detectors for pathogens, we also began investing in the architecture to try to analyze the large amounts of data and get some knowledge out of this vast amount of data that was produced. But even at that, it's clear that just the pure engineering technology portion of this was not the full solution. It was only a facilitator in getting to the solution, working in partnerships with many other disciplines, computation, medical sciences, and so forth, to understand all these things. It's clear that this takes a systems approach to solve the problem. You know, epidemiology, treatment, computation, how effective are the things that we do, all these things really come together in kind of a systems approach. In fact, one of the things that an engineer learns, perhaps not in school, but they certainly do when they're out in the real world trying to build systems, is they always have to think about things in a systems context. So having grown up in the aerospace and defense world, there's a problem to be solved. And say the problem is I want to hold some target at risk. Well, when you do that, you need to worry about, well, what's the warhead, for example? How do I deliver the warhead? What about the airplane that might carry it? How do all the airplanes work together? How do they work with communications? What about the satellites? What about the ships? How about the battle? How do all these pieces come together? And I would submit that in the case of the problem at hand here, trying to understand infectious diseases, that is a similar issue, right? There's an individual who maybe is ill or who might get ill, but that individual is part of a family, who's part of a community. You know, there's a hospital that's involved, or multiple hospitals, and then there's a region of the country. You know, we all know every year at flu season, you can look at how serious the flu is spreading in certain regions of the country. But it's not about just treating a person. It's a system that goes from the person all the way up to an entire region, a country, or potentially even the globe. But one thing we do need to be careful of, in fact, I used to worry about this a lot, is even if we can collect large amounts of data, even if we know how to process the data and get meaningful information out of it, one of the things that I always worry about is the security of that data, the notion of cybersecurity. Everything from data being corrupted, to data being stolen, to false data being put into a system. There is actually a cybersecurity piece of all this stuff. You know, it wouldn't be all that hard for a cyber attack to, for example, set off a bunch of detectors to suggest that there is an issue happening when in fact there really isn't one, and then it would be a large motivated response that in fact was really quite inappropriate. But as we look more carefully at this issue here and look at the health focus of these things, it reminds me of a report that we did actually 15 years ago that was done between the National Academy of Engineering and what was then the Institute of Medicine. And we did a study and produced a report that was called Building a Better Delivery System, that emphasized the real collaboration between engineering and medical sciences. It's interesting, Victor and I were having a conversation beforehand. When I was a young engineer in school, everything was about the interface between computation and engineering. Now the interface is between medical sciences, computation, engineering, life sciences, and all these. If I was a young kid in school today, I know where I would go. I would go right at the confluence of all those fields. And clearly, I think that's where many of these solutions lie. So in summary, what I would say, there's no doubt that big data is part of how we crack this problem, the analytics of how you collect it and how you solve it and extract information from these large seas of data. And all these things, I think, enable us to actually now think about new strategies to deal with the problem beyond those that we've had in the past. And all those call for an active partnership between engineering and medicine. So with that, I wish you all a very productive meeting. I'll be here for a good bit of the morning and certainly would be willing to chat afterwards, but good luck and a job well done.